I'm Dr. Scott Sicherer, and I'm the Division Chief of Pediatric Allergy and Director of the Elliot and Roslyn Jaffe Food Allergy Institute. I'm Professor of Pediatrics at the Icahn School of Medicine at Mount Sinai's Kravis Children's Hospital. We actually manage all sorts of allergic issues, whether it's allergic asthma, atopic dermatitis, which is otherwise known as eczema, hay fever, otherwise known as allergic rhinitis, drug allergies, allergies to other substances. We take care of allergic skin disease like hives, but we specialize particularly in food allergy. We're essentially we've been doing food allergy since 1997 with research and patient care, and we're considered a discovery center of distinction by the lay organization called FAIR, or Food Allergy Research and Education. So I like to think that our care is comprehensive, holistic, that it's cutting edge and very compassionate. We have 11 allergists who are taking care of patients here, and they not only do clinical care for patients, but they also do research. They write papers, they teach in the food allergy space. Dr. Wang and Oriel, for example, they run a yearly course where other allergists and pediatricians come to us to learn more about food allergy. Not only do we have these amazing group of allergists, but we also have special programs to provide comprehensive care for people with food allergies. So for example, we have the Empower program, and that's a program where we look at the day-to-day psychosocial and quality of life issues that people with food allergies and their families deal with. It's a really impactful thing to have a food allergy. It's almost like living in a landmine, and you never know if there's going to be an allergic reaction, and it affects all sorts of parts of our lives and families' lives. And so we actually have worked with Eyal Shemesh, who's a psychiatrist, to do research and improve patient care in that area. We also have a Center for Eosinophilic Gut Disease, which is like allergic gut disease. Dr. Mirna Shahade runs that. She's a gastroenterologist who's in our division, who helps help our patients who have this allergic gut disease. It's very common. We also have two dietitians, Allison Scheibel and Marion Groch. Marion Groch is on faculty, and she also does education and research and teaching around the role of diet and nutrition for those with food allergies. Again, this is very important because people who have food allergies are on limited diets, and we have to make sure that they get really good nutrition. On top of this, we have an amazing group of nurses and medical assistants who make our patients smile and help us to do the clinical work that we do and our research. Food allergy diagnosis is not a simple thing. And I bet that you're thinking, well, he's going to say do a blood test or skin test, but it's way more complex than that. I'm really proud to say that our researchers here, for example, Hugh Sampson and others such as Mary Grace Baker, Jacob Catan, Amanda Ajamang, Sasha Grishin, they've done a lot of studies that have really changed the face of how food allergy is diagnosed by finding novel methods of diagnosis, which have already come into play and are used worldwide, and new ones that are improving diagnosis even further. But the starting point, surprisingly, is the history. Most people don't think of a history as a test, but when you come to see our allergist or me, we're going to be asking you so many questions, your head's going to spin. You've had an allergic reaction to something. We're going to want to know, what are the ingredients? What were the symptoms? We want to make sure, yes, it's actually an allergic reaction that we're talking about here. A lot of times people will come in and they'll assume, well, it was a dish with some shrimp in it. It was probably a shrimp reaction. Well, we're going to be asking you about what the other ingredients were, what sauces were there, because we want to make sure that we don't miss something. And sometimes it'll be a spice or an unusual ingredient that'll cause an allergic reaction. And we need to really get to the heart of all of those details to get an idea of what the culprit food might be. Now, we do have excellent tests that we can add to that history. There's skin testing, which is little scratches on the skin. This is essentially painless, looking to see if the skin responds to extracts of the foods that we might expect could be the allergen. And we also do blood tests that measure the immune system. So the immune system is the part of the body that usually protects us from infection, but in allergy, it's the bad guy. It makes a protein that helps to attack the foods that people are allergic to in kind of counterproductive way. And the blood test can measure that. And we use these tests to help guide us in making a diagnosis. The allergy tests, the skin tests and blood tests, are not like a pregnancy test. They're not a yes/no test. And if I just grabbed people out of the park and said, I'm going to test you, for example, the peanut allergy, you would find that about 10% of people are carrying a positive test, but most of those people are not actually allergic. And the allergists here understand all of that, and we'll talk you through it. If we aren't sure if someone is allergic, they outgrew it, and happily many people do outgrow their food allergies, then we might do a feeding test. That's technically called an oral food challenge. We do thousands of these each year, and it's really the proof is in the pudding kind of test, meaning that we're feeding the person the food to see if they have any symptoms. We start with a very small amount and gradually increase under careful supervision. And as soon as someone may have any symptoms, we stop. But it's the best way of finding out if someone is allergic, and we do those all the time. The great news about food allergy is that the field has changed so much, a large part in the work that we've been doing and looking at therapies. The mainstay of management of food allergy is you get the diagnosis, we identify the foods that you're allergic to, and the first instruction is to avoid those foods. That's pretty straightforward, but it takes a lot of education. We'll teach our patients about restaurants, schools, managing at parties and all sorts of different social events, how to read labels. All of that takes a lot of education. We also teach our families how to recognize an allergic reaction and how to treat it. That might include treating it with medications such as epinephrine that come in automatic injectors, such as the ones I just showed you. So we educate our patients on when and how to use these very safe medications. Epinephrine is the primary medicine to treat anaphylaxis, a severe allergic reaction. It's a safe and effective medicine that could be used if a reaction is progressing. And we would tell you all about that. But that's just part one, because although we could make your life very safe, we want to hopefully someday get rid of these allergies. And we're making amazing headway in this. In fact, there's one FDA-approved therapy now for food allergy. It's called peanut oral immunotherapy, and it goes under the name Palforzia. Dr. Julie Wang here led the studies that we were doing in collaboration with many others to move this therapy into the point where now it's an FDA-approved therapy that's available here at Mount Sinai's Jaffe Food Allergy Institute, as well as by allergists all over. It's done by giving a very small amount of, in this case, peanut, basically dust of peanut, and this is gradually increased over days and weeks and months, going up to a level that a person takes daily as a medicine to protect them from accidental exposures. It's not a cure. We still have them avoiding peanut, but it helps people to have an extra higher threshold in case they accidentally ingested peanut, even though they were avoiding it all along. This approach is not yet FDA approved for other foods, but we have active ongoing research in looking at this particular therapy for other foods. But our work is way beyond that. We have a food allergy treatment and research center. Dr. Jacob Catan and Amanda Cox run that, as well as other allergists here, Dr. Oriel and others who work in that center to look at the different research for different approaches to treating food allergy. It's very exciting because I really can't imagine that in the coming years, we're not going to have something that's much more easy to give and definitive to give to help people be safe with their foods and maybe being able to eat the foods that they've been avoiding. We've been looking at therapies such as putting a patch on the skin, sort of like a nicotine patch for food. We've been looking at therapies that are small amounts of food under the tongue. We've been looking at biologics, which are injections of different therapies and molecules that affect the immune response in different ways to try to get rid of or at least make it safer for people with food allergies. And there's a lot of promising activity in this area where, I think we're seeing a very big change in what's going to be available in the coming years to make it safer for people with food allergies. So studies that we did years ago showed that, for example, peanut allergy tripled in prevalence from around the mid 90s to the later 2000s. I didn't even believe my own studies at the time. Like, it went from 1 in 250 to 1 in 70 children with peanut allergy. But other studies confirm that there's been this change. And we're not 100% sure why. There's a lot of theories as to why. But this really has made prevention a major focus for us and many others. One of the things that's come to light is that earlier introduction of the foods into the infant's diet can be protective. So, for example, recommendations that go back over 20 years originally said, well, if you're prone to food allergy, then don't feed your baby common allergens like milk, egg, peanuts, tree nuts, or fish. And they would say, don't give it, till age 1, 2, or 3 years. Now, thanks to a number of studies that have been going on, we've changed those guidelines, and the American Academy of Pediatrics, the National Institutes of Allergy, Infectious Disease, and others. And I will say that myself and many of the other allergists working here, such as Dr. Sampson and Wang and Marion Groch, our dietitian, have been part of these changing recommendations. Now we're advising almost the opposite of what I'll call the old days. We're advising that the introduction of foods like peanut in infant-safe forms, egg in cooked forms, and as well as the other allergens I mentioned, be introduced around 6 months of age, not before 4 months of age. And they're really to be thought of in a similar vein as just other foods that you would give a baby. So you shouldn't be differentiating these foods from other foods like you might be giving rice or vegetables or fruits, other foods that babies get. The allergen should be part of this. I don't have enough time right now to go through all of the details of these recommendations, but we've promulgated these to pediatricians, and hopefully the word is out and you can talk to your pediatrician, and we're happy to speak to you more about these as well. But it's very exciting to be able to make a change that will hopefully prevent food allergies going forward. We're looking at other prevention strategies. One of the theories as to why food allergy has increased has to do with the germs that we live in. There's more food allergy when people are living in industrialized areas compared to farms where there's more natural exposure to germs. So the microbiome, the germs that live on and in us, might be changing because of our lifestyle. And we're looking at those studies. We're looking at the nutrients in our diet because people are eating more unhealthy fats. They may not have as much vitamin D as they used to. So there's a lot of additional possible prevention strategies that we're doing research on. Well, I'm proud to say that studies that we've been doing over the past couple of decades have really changed the way that food allergies are approached and managed globally at this point. Just as one example, led by Hugh Sampson and others, it was noticed early on that, or it was assumed early on, that everyone who's allergic to egg and milk should just avoid egg and milk. But we learned that about 70% of children with egg or milk allergy could tolerate egg or milk when it's in baked goods, like a muffin or a cookie. And it turned out that not only did doing that improve quality of life for these children, but it also made a gateway for them to increase the amount of milk and egg in the diet. And eventually it seems that children who are able to and include the baked egg or baked milk products in their diet end up having a better prognosis with their milk or egg allergy, and often end up being able to add it back to their diet long term. Our research has identified that foods play a cause in eosinophilic esophagitis. Our research has found a variety of pathways toward potential therapeutics. So I'm really proud of all the research work that we have been doing. I want to point out some people who are doing specific avenues of research now, and some of the bigger studies that we're doing. Cecilia Barron, who's the deputy director of the Jaffe Food Allergy Institute, she looks at a specific cell in the immune system. We call it the T cell. It's kind of like the general of the army when it comes to the immune system, and it directs the immune system to do good things like fight infection versus bad things like allergies. And so she's doing studies that are unraveling where these cells play a role, which helps us tremendously in trying to find therapeutics and better diagnostics. Supinda Bunyavanich is looking at a variety of ways that the immune response to environment, for example, the germs that I was talking about earlier, plays a role in allergy, as well as how genes get activated to make allergy happen or not happen. And so she's found, for example, certain bacteria colonies that exist in people who may be more likely to develop a milk allergy or to resolve egg allergy or to hold on to egg allergy. She's looked at the ways that cells respond to allergens, which could give us pathways toward therapeutics. And she's looking at all of these in a very complex way we call systems biology, supercomputing, looking at multiple ways that these different environmental and immune and genetic aspects interact, which is really amazing to be able to understand this complex system. Maria Lafay works in a laboratory looking at B cells. These are the cells that make the proteins that cause the allergic responses that I've been talking about. And understanding those better might be able to identify pathways that could be interrupted to try to stop allergy. Our new faculty, Nicole Ramsey, is investigating biologics that can hopefully help to treat food allergy. I want to mention a few studies that we're doing now. They all have names, and those names are usually acronyms that stand for what they're about. I'm not going to go into the acronyms, but I'm going to tell you about the studies. One is called Activate, and that study is led by Hugh Sampson and Angela Twong. I mentioned earlier that we're seeing more allergy these days, and it's been noticed that babies who are born by C-section have higher rate of allergy than those who are born vaginally. And we think that's because coming through the vaginal canal, they're coated with many bacteria that might teach the immune system good things and help to prevent food allergy. So in this study, we're actually using the mother's vaginal microbiome, her own vaginal bacteria, to coat the baby who's born by C-section versus not doing that, to try to find out if we can use that to help to prevent food allergies. We have a study called Cafeteria going on. About half of the children with peanut allergy are not super sensitive. They might be able to eat 1 or 2 peanuts or even 5 or 10 or 20 peanuts before they start to have symptoms. We don't know what to tell individuals who have that higher threshold of allergy. Most of our studies have focused on children who are allergic to the tiniest bit of peanut and might have a reaction from even these very small amounts. So in this study, we're trying to figure out, if you have a higher threshold, are you better off sort of leaving well enough alone? Or should we try to give you some peanut and increase that amount to try to push on the allergy? And we're very excited to be undertaking that government-sponsored study. We're also starting a study called Sunbeam, which is a birth cohort study. For all of the pieces of the puzzle that I've mentioned so far, we really need to better understand why some children develop food allergies and why some don't, and what the early risk factors are. So this is the first birth cohort study. There's multiple sites across the country. We're cooperating with many different centers to hopefully get about 2,500 babies into the study so that we could learn early ways to predict and then hopefully prevent who may develop food allergy. We have many other studies that are ongoing looking at different therapeutics that we're very proud to be taking part in. Some of these are industry-sponsored studies. Some of these are philanthropy supported studies, and many of them are government sponsored studies. So this is our goal, to get a better therapeutic, better treatments, prediction, prevention, and diagnostics. And as I said, we've made a lot of headway, and the future is looking very bright for this. So there are many ways, and I want to just start out by saying, take a look at us on Facebook. You can type in Facebook Jaffe Food Allergy. That's simple, and you'll find our Facebook page. We have a research email list, and we announce our studies and also what we're doing both on Facebook and on the email list. And you could get on our email list by emailing Food Allergy Research, it's all one word, at mssm, like Monday, Saturday, Saturday, Monday, .edu. Ask to be put on that mailing list. We have a parent advisory board chaired by Helen and David Jaffe, who helped to get together families so that we can talk to them about living with food allergy, about research progress, and a whole bunch of other topics of interest, management issues. you'll see on our Facebook page the different talks that we have supported by this parent advisory group. You can attend these. Currently, they're on Zoom. They used to be in person. And you'll see that there are a lot of different topics of interest that I think you would be interested in hearing about and maybe also joining in on these activities. We also depend a lot on philanthropy to do these studies and to make the amazing advances that we've been making. You can help us in that support by looking online at giving.mountsinai, all one word, .org/Jaffe, Jaffe, and you could help us by donating there. And I'd say lastly, we've had tens of thousands of research participants over the past 2 decades and more. And it's really those research participants who help to move the field forward. They're the heroes. They're the children and their parents who come to us. I like to think of us as a most trusted source for food allergy and for food allergy research, and give of their time to help us help you to learn more, to find these advances that we and others are moving the field forward with. And so being a research participant is really an amazing contribution and is something that you should consider. And keep your eye out on those emails and Facebook page for how to get involved. And with that, I thank you.